Hi, everybody. I'm Dr. Kaitlin Riegler, and today I have the pleasure of speaking with Dr. Melissa Womble. Dr. Womble is a fellowship-trained neuropsychologist with specialization in sports concussion management. She currently serves as director of the Inova Sports Medicine Concussion Program and co-director of the Inova Concussion Program. Dr. Womble is going to be speaking at the upcoming SNS conference in Philadelphia in May, giving a talk titled Identifying Concussion Clinical Profiles, a Clinical Case Discussion. Dr. Womble, thanks for being willing to speak with me today about your talk.
Of course. Thanks for having me.
Of course. So just to kind of jump in, your talk is going to be a clinical case discussion, which is a little bit of a different format than what we've seen at SNS in the past. Can you explain why this is such an important or helpful format for this symposium?
Yeah, I think it's a great addition to the symposium. And as you mentioned, kind of different from in the past. Based on the agenda that's out there, there's going to be a lot of discussion on use of the clinical profiles and how to recognize the clinical profiles. So I think a case presentation kind of puts it all together and helps illustrate how to use the various pieces to come up with that clinical profile, and then direct treatment based on the profile or profiles that are identified.
Yeah. Yeah, this has definitely been an emerging area of research kind of growing in recent years, the idea of these clinical profiles. Is this something that you regularly use in your own clinical practice?
Yes, on a daily basis. This is, our whole goal with patients is to identify the profile or profiles that are present and then direct the treatment based on those profiles that are identified. That way we streamline care for the patient, try to avoid over treatment and get that patient back to normal functioning as soon as possible.
Yeah. And, for people who maybe aren't as familiar with these profiles, what might an example of one of these be?
Sure. Yeah. So the vestibular profile has been put out there in various research articles. So your vestibular system is really responsible for your coordination of your head and eye movement and also your balance. We see more of the coordination of your head and eye movement following concussion. And so if you recognize that somebody's having a vestibular issue, typically through talking about symptoms and then also doing a screening evaluation like the VOMS, then you can determine if that's playing a role in what they're experiencing in everyday life, and then make recommendations for treatment. In some cases, they need formal vestibular therapy. Sometimes you're able to talk them through exposures in everyday life that are going to help that system get better on its own. And so that's the kind of situation that we can highlight through a case presentation in terms of how to make those decisions.
Yeah, it sounds like really getting closer to like a precision medicine model where based off of that specific profile, that's really going to guide the individual treatment recommendations for that patient.
Right. I think, obviously historically in the past, concussion was kind of viewed as a one size fits all. And, luckily we've moved away from that, but it's not perfect, especially, across the country, there's not consistency everywhere in care. So, as you mentioned, hopefully this helps move towards more of that precision medicine and individualized care for these patients.
Yeah, that's great. So do you have a certain takeaway that you hope neuropsychologists specifically can get out of your talk at the symposium?
Yeah, I think, as we kind of talked about application of the tools and how to identify profiles based on what you're seeing in the tools. And from that, then guiding a specific treatment plan for the patient. So I think, there's obviously a lot of different techniques and tools that we can use with these concussion patients, but I think sometimes everyone doesn't understand how to incorporate them all together to then utilize those and make the best decisions for the patient. So I hope, my talk will help kind of bring all those mentioned components through the earlier talks together to help with more clinical application.
Yeah, yeah, it sounds like it's going to be a great series of talks at the symposium leading up to this case presentation. So Dr. Womble, thanks again for speaking with me. I look forward to learning more about concussion clinical profiles at the SNS Symposium in Philadelphia this May. And those listening can read more about the conference and register to attend on the SNS website, which is sportsneuropsychologysociety.com. And you can also follow SNS on Facebook and Twitter for updates. So thanks again, Dr. Womble.
Thanks for having me. Look forward to seeing everyone in May.
Yep.